In our practice, for insulin uncontrolled patients or new insulin prescribed patients, we will keep a close follow-up with them through phone call or line. However, we face some challenge in reaching these patients, like call who often got an answer, and also getting relevant information like SMBG, insulin dosing, compliance, and other lifestyle data.
What makes it more challenging is that some patients don't come back for follow-up until 6 to 9 months later, or some of them just come back and ask for the chronic continuous prescriptions, delay the time for effective titration. Before we knew these programs, we often lose patients to follow-up, and titration adherence was low.
What I like most about the Health2Sync platform is it helps patient engagement become more convenient. Patients could log their SMBG in app, and they could also type the dosage they took at their convenient time. As long as we have the authority of patients, all the data will be accessible to us from the Health2Sync platform.
The titration alert of the Health2Sync platform has been integral in managing insulin patients. Instead of having to sit through all the patients, the titration alert simplifies the process by alerting us about only the uncontrolled patient who may need titrations. The criteria is at least 3 fasting plasma glucose logs, and average uncontrolled in the past 7 days. This saves precious time, which can be spent on more patients. The use of Health2Sync systems was associated with a decrease in fasting blood glucose of 50 mg per deciliter. There was a mean increase in insulin dosage of 50 units. The glycemic improvement was a decrease in HbA1c of 0.66% after 6 months.
After I log it to the platform, I could check the notification, checking the carry priority from the titration alert. For example, while I see the patient's alert, I will go check the patient's SMBG and dosage. If he or she needs an adjustment, I will send him or her a message from the platform. What we have found is that timely titration does not just help the patient achieve quicker glucose control, but also help to build a deeper trust with our patients. The patient rely on your caring, tending to be more adherent to their medication and coming back for follow-ups.
The online titration and discussions also serve as touch points to remind the patients and indirectly deepens the relationship. As I know, patients who join the programs in Taiwan overall reaching controlled status 1 month earlier, with 66% more in HbA1c improvement. Additionally, this tool helps you to set yourself apart from the many hospitals and clinics which are offering traditional reactive health care only when patients come in. Many of our patients have experienced their appreciation for the programs. Some have even recommended us to their friends and family.